Welcome to our latest episode of Wellbeing Wednesdays, the National Council's virtual series on healthcare. In this episode, Rebecca Farley-David, Senior Advisor of Public Policy and Special Initiatives at the National Council for Mental Wellbeing, will sit down with Nebraska Governor Jim Pillen and Annette Dubas, Executive Director of the Nebraska Association of Behavioral Health Organizations, to discuss Nebraska's response to the mental health crisis, bipartisan efforts to address the crisis, and the role CCBHCs play in helping communities throughout the state. Now, please welcome our host, Rebecca Farley-David.
Thank you for joining us today for Wellbeing Wednesdays, the National Council's virtual town hall on mental well-being. This is where we explore issues that affect the delivery of care and those who provide that care. Today, we have two very special guests. I'm honored to introduce our first U.S. governor on the show. He's also our first veterinarian. He represents the great state of Nebraska and was sworn in on January 5th of this year. And in less than 6 months, he's demonstrated meaningful support for people with mental health challenges and for the organizations in Nebraska that provide mental health and substance use treatment and care. It's my honor to welcome Governor Jim Pillen. Thank you for joining us today.
Well, thank you, Rebecca. Pleasure to be here. Real pleasure to be here with former Senator Dubas. And it was really exciting when we signed the bill into law, and it was really cool to see Senator Dubas's deep passion and joy, thinking this would never happen in Nebraska. And the thing that's extraordinary privilege to be the 41st governor of Nebraska is to be able to bring common sense to the party and make sure that we all step up and helping neighbors. That's what we do in Nebraska. And so real easy thing to be a part of. And I give kudos, Rebecca, for you being a part of this for 13 years and really excited in Nebraska. And I know Annette is to duplicate good work that's been going on in other states. And we're excited about the future. It's going to be really a big deal for Nebraskans.
Thank you so much, Governor. And I also want to introduce a friend who I've had the pleasure of working with over more than a decade. She's a fierce advocate on behalf of National Council members in her state. She's also, as Governor Pillen said, a former state senator in Nebraska who served 2 terms in the state's unicameral. Today, she's the executive director of the Nebraska Association of Behavioral Health Organizations, which is a member of the National Council. And I have to say that Nebraska's community mental health and substance use provider organizations are in good hands because it's hard to imagine a smarter and stronger advocate. It's my pleasure to introduce Annette Dubas. Welcome.
Well, thank you so much, Becca, for those kind words and that introduction. And I want to especially thank you and all of those who work for the National Council for Mental Wellbeing for what you do on our behalf. We're better advocates because of what you do and how you arm us and help us understand the issues and support us. And as the governor mentioned, there were moments as I listened to all of the other states across the nation talk about having CCBHCs in their state and thinking this is never going to happen in Nebraska. And I was envious of what they were able to do, but also appreciative of always your words of encouragement and letting me know, Nebraska is going to get there, and we have. And so, I'm just very, very grateful. And Governor Pillen, we're especially grateful for the support that you gave to the legislation and coming and testifying in support. I don't know what happens in other states, but I know the governor doesn't just show up at every hearing in support of every bill. So that went a long way to getting us where we are today. And and really recognizing that you are making behavioral health care a priority for all Nebraskans. And that just means a great deal to us. And so we're looking forward to a long partnership with you and really making good things happen in Nebraska for the providers and for the consumers who receive that care.
Looking forward to that. I think that I would be as guilty of anybody if I love Nebraska so much that I've viewed everything as being perfect for a long time. And I think that one of the things that's important for us to do is, and I spoke to a group earlier today and talked about it, that it's important that sometime us lifetime Nebraskans have so much passion for our state that we want to think everything is perfect. It's really important for us to really make a difference is we've got to start recognizing that, we have mental health problems, we have substance abuse problems, we have poverty problems in every single one of our communities. And if we can get the gold lenses off and recognize that, the cool thing about Nebraskans is Nebraskans step up and help neighbors in need 100% of the time. Sometimes we're slow in recognizing it, and this is really going to be a helpful program.
Well, this is such a good way to set the stage because we do have a lot of ground to cover. And today we're talking about mental well-being and policy solutions and what that looks like in Nebraska, where you both have had so much success lately in identifying the need and addressing that need. So I wonder if we can start, let's follow up on this conversation that you started about the needs in Nebraska and briefly set the stage for us. So Governor Pillen, we know more and more people are experiencing mental health and substance use challenges across the country. But what does that look like in Nebraska?
Well, I think that what it looks like in Nebraska, I don't think it makes any difference whether we're in a urban community or if we're in a rural community. The hardcore reality is there's lots of challenges in every single community, and so I think that when you look at poverty, when you look at substance abuse, you look at behavioral health, you look at mental health, there's a lot of times that when we're in communities that everybody works incredibly hard, they get home and they want to take care of their families. Sometimes we don't see and understand as much, and so I think we're making strides in the state of Nebraska. And, I think that what I'm so excited, why it was a no-brainer for me to be supportive of the certified community behavioral health clinics and turn that into law is that, I've been out across the state for over 2.5 years in all 93 counties, and countless sheriffs and deputies talked about the challenges and how they were overloaded in dealing with things they're not equipped to. Same way in emergency rooms across critical access hospitals. Same way we've done transformative school funding, and I've met with countless superintendents across the state, and the same things that happen in schools. So those are issues in all of those places where everybody needs more help, and we need more providers. And I think those are important. I have a daughter that's a mental health specialist in Philadelphia, and quite honestly, a lot of the challenges that she deals with would be very, very similar to what we deal with in rural Nebraska.
Annette, would you like to add to what the governor has described? Does this fit with what your members are seeing? How would you describe the needs in your state?
Absolutely. I mean, 88 of our 93 counties are federally designated mental health shortage, worker shortage areas. And of those, 29 of them, I believe, have no behavioral health provider at all. And especially in rural areas, there's a shortage of prescribers. So yes, the shortage is there. And if you don't have providers, that certainly impacts access to care. But by the same token, I am so proud of my members and the community mental health providers and substance use disorder providers across the state, that while they recognize the challenges and as they work hard to recruit and retain workers, to build that capacity and to make sure that all of the people that need care are getting care, they're thinking outside the box. They're looking for ways to make sure that those who need that care, they're able to access it. Telehealth has certainly been beneficial, but yet you still need the workforce, manning that telehealth. But, when over half of our workforce is over the age of 50, that says, this is going to be an ongoing problem. So what do we need to do? Thinking outside the box. What are ways that providers can come together and make sure care is being provided? We have a very geographically diverse state, with the more urban areas and population areas in the eastern. And then as you continue to go west, that population starts to drop off. And as you get into the more frontier areas, that again becomes more challenging. But that doesn't mean that those individuals don't need the care just as much as if they lived in the Omaha or Lincoln areas. So, CCBHC, I think, is going to be, it's not the be all and end all, but I think it's going to be a great step and a great example of what are some of those things that we can do. As I said, those outside of the box ways of providing care that I think we'll see trickle across our entire state.
So you both spoke so eloquently about the need, and you also mentioned some of the challenges with workforce. And I want to come back and talk about workforce capacity to meet those needs in a little bit. But first, let's shift the conversation to your response in Nebraska to the mental health and substance use crisis that you just described, because that's what's really exciting to me. What you've done in Nebraska, I think, also serves as a model for other states, not just the policy solutions, but the bipartisanship as well. So let's talk about what you all did. The Certified Community Behavioral Health Clinic Act, which was approved by the legislature on March 28th of this year, by a 46-0 vote. And let me reemphasize that, in a unanimous vote, it's a profoundly important measure. It will expand outpatient mental health and substance use services, crisis mental health, outpatient clinic primary care screening, psychiatric rehabilitation services, peer support, counseling, family supports, the list goes on. Now, here at National Council, we know a bit about CCBHCs, and we believe in them just as strongly as you do in Nebraska. So, Governor, I wonder if you could share what it is about CCBHCs that convinced you to actively support this policy solution together with members of both political parties. And feel free to give us an update on the newly enacted law, because I know activities are underway.
Yeah, well, I think that, so let me just, I hate politics, right? What's important as the governor of Nebraska is do what's best for Nebraska. And Nebraskans are really, really good when they know there's a problem and stepping up and helping solve the problem. I'm a believer that we need government out of our hair, but there are exceptions to that rule where government has responsibilities to help make a difference. And when you take a look at our communities across this great state, we have communities that some of us are old enough that would like to call them Mayberry, but the hardcore reality is that there's parts of every one of our communities that have incredible challenges. And so that's not, mental health and behavioral health knows no colors of S. It knows no socioeconomic barriers. It affects many, many, many families, some in poverty, some in extraordinary wealth. And so the thing I think that I'm personally really excited about it is this really brings a holistic approach to solving the problem. And it brings in Nebraska, agriculture silos have been extinct for a lot of years, and this helps bring more folks together, collaborating to solve the problems. And, we obviously are workforce shortage for mental health providers. We just finished recognizing 31 students with a perfect ACT score in the state. And there's a couple that are going to go into the psychology field. So we have to keep communicating about the needs. We have to do more energy on recruiting so that we have the workforce. I believe we've done some things within community colleges to support them from the state level, that there'll be opportunities there as well to grow the workforce. We obviously the federal funding will also help with the provider rates. So that's really an important piece of it as well. So multiple factors. There's no one solution. I'm a believer that the more we can bring everybody together and have everybody working together, it is the best way to solve the problems.
Annette, can you tell us from your perspective and the perspective of your members, what will the expansion of CCBHCs mean for access to care and for overcoming barriers to care?
I think one of the key components that maybe we don't talk about a lot related to CCBHCs is that data collection component. And that is something that is really missing in the world of behavioral health. If you're a physical health provider, you can talk about your patients who have diabetes, and if you provide certain types of treatment, this is what's going to happen, and you can show hard data backing up that treatment X works, and this is what happens when you provide it. Or if you have a cancer patient or someone with high blood pressure, all of those types of physical ailments, it's a lot easier to track data and outcomes and prove that certain treatments are beneficial. We don't have that in behavioral health. Behavioral health is a little more abstract, and the brain is certainly a lot more complex. But with the way CCBHCs are set up and that a critical data collection component, so we're going to be able to see this CCBHC identified this array of services and determined this was the way they were going to provide them in collaborating with their communities, their schools, their law enforcement. And these are the outcomes they hope to achieve. And to be able to go back to the legislature and say, this is what's happened. This is your investment in CCBHCs is proving that these types of treatments are working, and they're preventing, the problems that our schools are dealing with. Hopefully they're dealing with the problems in corrections, and we're reducing recidivism and actually keeping people out of those high cost services. So I think that data collection component is really critical, and one that maybe we don't spend a lot of time talking about. And then just going on with just the whole integrated approach. So we are talking about the whole person, their physical health needs, as well as their behavioral health needs, and going in and determining with the community, what are your needs? And then how do we develop a CCBHC to meet those needs? And then I think, the most obvious one, and the one that as an association we spend a lot of time talking about, is rates and how do we pay our members? Well, when we're finally able to determine we're going to provide these services, and this is actually what it's going to cost to provide those services, and this is what we will pay you to provide those services, I think is going to be an incredible benefit that we're going to be able to support through data as well. So I think there's a lot of things. And even if a community doesn't have the capacity to have a CCBHC, I think the benefits that we see coming from those CCBHCs, we'll be able to extract things from them and use them, in different areas across the state that maybe are more a little geographically challenged or provider challenged, but we'll be able to take what works and kind of, distribute those successful practices across the state.
Well, Annette, I have to say, as a data nerd, your comments about leveraging this to have a better sense of the data showing outcomes and impact is just making my heart jump for joy. And certainly, I think we can see this happening across the nation, as well as more and more states move towards the CCBHC model. But one thing that we don't see everywhere, and I want to hit this one more time before we move on, because you deserve so much credit for getting this done in Nebraska. Governor Pillen, the CCBHC Act provided a great example of bipartisanship. And unfortunately, it doesn't always work that way. And as you said before, we know that mental health and substance use challenges aren't political issues. So what would you say helped the two sides come together to get this done?
Well, I think that the process in the unicameral Nebraska goes through committee hearings, and important to have conversations. When I understood everything that was taking place, I'm governor of all Nebraskans, and I simply said, I want to be in public hearings on really high value, really important issues to help make things better for Nebraskans. And so I was told, well, that'll be really unique. You'll be the only Republican governor to testify at a hearing for that Senator Wizard's bill. And I said, well, it really doesn't matter. It's a no-brainer for Nebraskans. And I believe in it 100%. I understand it because of my family's dynamics, and it's just important. It's really, really, and then with my experience being across the state, campaigning and meeting people everywhere, it's one of the top issues, whether you're talking to the emergency room physician, or if you're talking to folks in the school systems, or to the law enforcement. So being there to be supportive of the bill immediately from day one, I think was important. And I did it because I believed in it. No other reason other than believe in it and believe it would make a big difference for Nebraskans. And I think, the other maybe piece that hasn't been talked about it through all this work is it's going to be really important that folks have same day access. They have care when they need it, and not try to figure something out a week later. So these are going to be things that are good. And obviously the other piece that was really, I think, helpful is, there was proof in the pudding in other states. Kansas has been successful, Oklahoma's been successful, Missouri's been successful. So those are states that kind of live and walk the way we do. And so that made it, wow, I'm a proof in the pudding kind of person. So, this wasn't something to hope for. This will be awesome for all Nebraskans.
Well, I have to say, I'd love to think that other governors are out there watching this broadcast and will feel similarly inspired to go testify before their legislatures on behalf of mental health and substance use. And thank you so much for your advocacy on behalf of the providers and the folks that they serve. Annette, speaking of bipartisanship, are there other opportunities to make progress on issues affecting the mental well-being of people in Nebraska?
Always. And I think, again, that lends itself to the unique nature of the way our policy is developed in Nebraska. And, we're able to develop those relationships with key senators and have that one-on-one conversations with them and engage through the committee hearing process. So I think that affords us many opportunities. And then when you have an administration that is supportive as well, that doesn't hurt. That gives a lot of credence to the work that we're doing. But when you have mental health needs named as the top one or two issues of concerns across every sector, public and private, that gets the attention of policymakers. So it's not just mental health providers coming in and saying we need to do this. We have our schools, we have our law enforcement, we have our corrections, we have, our business community. Everyone is talking about it. And so, to be able to build those coalitions and talk about how do we meet the needs of Nebraskans so that they're getting the mental health and substance use disorder care that they so desperately need, despite the challenges of workforce or whatever it is that may be out there. So I'm just so encouraged and so optimistic about where CCBHC legislation takes us going forward. I think it's going to be a huge springboard for some pretty significant changes across our state in the way we provide care for our citizens.
Well, I love that you mentioned the support from other sectors coalescing around improving access to mental health and substance use care, because those other sectors experience just as many challenges when people can't access timely treatment. And so this takes us back to something you brought up earlier that I'd love to dive into more now while we have a few minutes left, about how CCBHCs can boost capacity in the behavioral health system. CCBHCs, I would say, don't just improve access to care and break down barriers to care. they can also boost employment because they change reimbursement models. So let me start with you on this one, Annette. Are your members in need of more workers? You mentioned there's 29 counties in Nebraska that have no behavioral health professionals at all. Is the demand for professionals greater than the ability to meet that demand? And what does that look like in your communities?
Absolutely. And I don't think we're unique. I think it's across the nation that there's just an incredible workforce shortage. And, post-COVID, we knew, we talked when COVID hit, and our friends and colleagues in the physical health world who were just inundated with care, the need for care. We knew that was where they were going to be needed the most. But then as we kind of entered the post-COVID world, we knew that's when the behavioral health providers were going to see our surge in demand. And that has definitely happened for a lot of reasons. And there's always been, to some extent, a shortage of workforce in the behavioral health world, and COVID just has exacerbated that. So as I mentioned before, telehealth, that's certainly helped. And I think we can find, again, some more unique and creative ways to use telehealth to ensure that we're getting care to individuals, using our peers, using our community support workers. There's a lot of opportunities there to, as the governor mentioned, making sure that the minute somebody walks through the door, they're at least getting some immediate attention, and then we can work on what their more longer term needs are. But when over 70%, when the majority of my members are getting over 70% of their financial resources from public payers, that makes it a challenge. That makes us less competitive in the workforce world when we're trying to recruit workers. So when you can go work at Menards and get paid as much, if not more, as an entry-level person in the behavioral health world, that makes it a challenge. So I think the CCBHC model, again, will help us, evaluate how do we fairly compensate our workers. But, it just feels like, some people ask, well, when will we know when we get there? When will we have enough workers? Mm-hmm. And maybe we never will. And so that just tells us we have to be much more thoughtful and creative in determining the needs of our citizens, and then figuring out ways through CCBHCs. I think CCBHCs will evolve, and we'll see all kinds of offshoots coming, from them for ways these clinics can work in more less populated areas, or some of our geographically frontier areas. So as I just said previously, I think CCBHCs are a springboard, and that's what's going to help us to some degree address our workforce challenges.
That's such a great analogy of CCBHCs as a springboard, springing perhaps into additional policy solutions. So Governor Pillen, are there other measures under consideration in Nebraska right now to boost employment in healthcare broadly, and then also in the field of mental health and substance use care specifically?
Yeah, I think maybe a couple points. Had a saying forever, we always, if we're going to have great people involved in industries, we have to be in the marketplace. So the state, I think, increased payment at the state level, like in 2021. That was a step in the right direction. Working hard on creating more partnerships. So there's partnerships within the universities in Nebraska and our colleges, so that we can make sure young people understand that being in this field's extraordinarily rewarding and extraordinary public service, and a great career. And a special calling. I think that there are, I'm a believer that there's moments, there's times when it's important for the government to be a part of helping solve problems. And so, tuition reimbursement to stimulate young people to be a part of it. And then as payback, they stay in Nebraska and they serve. Annette's talked about it, the telehealth options. Those are really important, and it's important. Our administration, we talk about cleaning the closets out a lot. There are different things in line that create mandates, that create barriers in performing it. I'm a believer that some of those things, well-meaning when they were written X years ago, we have to get the speed bumps out of the way so that we can create access and Sure. So, I think there's a multifactorial issues. I think it's important that we start being more creative in thinking how we do stuff. I use our teacher shortage as an example. I ask people, I've been doing it for years, who are the 3 people that's impacted your life? And for anybody in this call, think about who are the 3 people. And I'll bet the farm, 100% of the time, one of the 3 people are a teacher or coach that impacted our lives incredibly. Why aren't we telling that story so that young people understand what an extraordinary career it is to be a teacher? Why aren't we have to be able to do a better job of making sure that we get young people to understand what an incredible career it is to be a provider, to help people when they're going through crises that they need help. And that when I tell you what, when I think of what my daughter does for people, I couldn't be more proud of her. And we just have to do a better job of making sure that every family knows that and understands that, and that we reach into the schools and so forth. Because the one thing in Nebraska everybody agrees on is our kids are our future, and our kids are our solutions to our problems. But we have to help them see it as well.
Thank you for those words. And I've been reflecting as you spoke, something that jumps out at me about your comments throughout our conversation. You've each talked about the need for mental health and substance use throughout the entire state, across all 93 of your counties. But I think I'd be remiss if I didn't acknowledge that Nebraska has some unique challenges. You have a vast state. It's 455 miles from Omaha in the east to the sign at the state's western border that reads Nebraska, the good life on the Lincoln Highway. And it's also a state with many small rural communities, and it can be difficult for people in rural communities to obtain treatment and care. How do you see the CCBHC model helping to extend care to some of those remote communities? And I'll direct that first to you, Governor Pillen.
Well, I think that one great example that we haven't talked a lot about would be the Centerpoint's work here in the state. I think they're in 15, 16, 17 counties. Topher and his group's done a great job. And using collaborative work, using out of the box thinking and problem solving. In our overall healthcare system, it's really important that we maintain critical access hospitals across our state in every 35 to 40 mile range, critical for acute care, but it's also critical then there are critical access hospitals is a part of this process, because as pharmacies close, as different things take place, we have to have a center hub. And I think that's a piece that will be important, that the clinics are closely associated with critical access hospitals. We have an access that's close by. In places where we can't do that, then obviously telehealth's got to become very fundamental. And we just got to communicate. The more the challenge, right? The more rural we are in Nebraska, the more independent we are, and the less we want to ask for help. So it's important that the more people can recognize it's okay to ask for help, the more that we can understand the need. The one thing I have 1,000% confidence in Nebraska, when there's a need, Nebraska can step up 100% of the time.
Annette, what would you like to add to that?
Well, I would agree with everything that the governor said, and no, we won't have a CCBHC in every community across the state, and especially as you get out into those more rural and frontier areas. But I do see opportunities for collaboration between some of those smaller clinics and our CCBHCs, wherever they're located in the state. Are there ways that they can take advantage of their services, again, through telehealth, or using our critical access hospitals as that kind of site where they can not have to go in for emergency care, but can actually go in and get get the care that they need prior to an emergency. So again, I think taking the things that are working in CCBHCs and trying to figure out how do we right size them to fit into our smaller communities and our more rural communities, and engaging those communities, whether it's through the schools, through the churches, through law enforcement. I mean, I'm seeing more and more our ag groups like Farm Bureau and Farmers Union. And I think just recently the soybean, their weekly report on our local farm radio station brought up the fact that May was Mental Health Month. And if you're feeling like you are in need of some help, I think they gave some numbers to call. So the awareness is becoming greater, which is awesome. So then I see that just leading to then how do we develop that access to care, and how do we encourage those providers who really hang in there out in our small communities? How do we support them to make sure that they're getting their needs met, as well as then what they need to do to provide care for those the people in their local communities. So again, I just see with every challenge, I see an opportunity, and that willingness to talk and collaborate. And I see that amongst my members. You know, we're a very diverse organization. We have the largest hospitals in the state as a member, all the way down to some of those more, as we refer to, mom and pop size organizations in the state. And they recognize that a rising tide raises all boats. And so everybody's willing to kind of set some of their personal agendas aside and figure out what is it we need to do collectively as an association to make sure that all Nebraskans are receiving the care that they need.
Thank you both. I know that two of my takeaways from this conversation are going to be, with every challenge an opportunity, and when we see a need, we step up and help each other. But before we conclude our time together, I want to thank each of you so much for spending time with us to discuss this important topic. And I want to give you the floor. Is there anything you want to address that we haven't covered yet?
You know, I think what is important is that we just recognize tremendous opportunities to work together and solve problems, and that's what we do in Nebraska, and recognize that you know, it's an issue everywhere. I mean, I was just in a metropolitan, you know, with the county sheriff in one of the larger counties in the state that received a grant that'll allow him to hire a sergeant with mental health credentials who will lead the behavioral health and wellness unit. So that's another example. There's countless groups of people working on it. One of the things our office is going to do, it's really important that we try to understand problems better. And we will work here and I've reached out to a number of different people that I know have been working in all different realms. And one of the coolest things I've experienced is how many different places I've been that have are providers and doing work, and incredible work. And as one person has said, yet, you know, we're just not hardly putting a dent in it. And I think that one of the things that I think would be really good for us, if there's ever a state in this country that can have a major breakthrough for mental health, it's Nebraska. So I think what we're going to do is put a task force together, and we're just going to talk about the problem and try to understand it to a fuller degree, and maybe something that maybe more collaboration comes from it, maybe nothing comes from it, but bringing people together to express their views and what their understanding is. I don't know about all of you, but I have a concern of what's going on with young people, access to things that probably create way more challenges for behavioral health. You know, I think that we just need to understand all of the different things that are going on in this world that our grandbabies are getting exposed to. I think that's important that we understand that better. And then the part that's incredible about Nebraska with Nebraskans with this subject, I mean, there are you know, there's just a ton of Annette Dubases that have been working tirelessly in this space. And I think that the more that we can bring everybody together to understand the base, perspective. And maybe I'm a believer that we have great opportunities for way more collaboration and understanding. And you know, our team, we're focused on major breakthrough, and that's what we want to be a part of. And so we're going to work on that, and together with a lot of great people that are doing things. What's going to come of it, you know, I don't have any idea, but I do believe it's a state's, I believe it's a responsibility of the office of governor to be a part of this conversation and this dialogue, and try to bring people together to have major breakthroughs. And this legislation is one small step in that direction.
Through CCBHC, we have an incredible opportunity here to change the way healthcare is delivered. Not behavioral healthcare, not physical healthcare, but healthcare, where we are looking at the whole person. We're treating them from their head to their toe. And I think CCBHCs are going to be that example of how do we meet the needs of those individuals. And we know, even though behavioral healthcare might be a small part of the overall spend for healthcare, we have that ability to bend the cost curve for those higher cost services. So if a person is mentally healthy, they're going to take care of their physical needs. They're going to take care of if they've got diabetes or high blood pressure or whatever it is. So they're going to be overall a healthier person, which is just going to pay dividends across the state. So I just see this as a step towards breaking down those silos, breaking down those barriers. And when we talk about healthcare, we're talking about healthcare for the whole person, from their mind to their body. And you know, I think behavioral healthcare, our providers, those providers who are out there doing this work every day, are recognizing that our voices matter. And when we raise our voices and we talk about the importance of the care we're providing, we can be very influential in the policy that is developed in our states. And we're proud of the successes that we've had. And it's taken a lot of hard work, and it's taken a lot of encouragement from the National Council saying, you guys can do this. And here's a little bit more information you can push out there to people. So it's like the governor said, it's that collaborative effort of coming together and talking to people. And really, at the end of the day, this is about Nebraskans living their best lives. And the way they live their best lives is to be mentally and physically healthy. And we can do that through CCBHCs and everything else that's going on across our state.
Well, thank you so much to both of you. That was a really wonderful conversation. I certainly feel inspired and reinvigorated in this work after talking to you both. And I really appreciate the time that you've taken out of your days to join us for this. This concludes our episode of Wellbeing Wednesdays, brought to you by the National Council for Mental Wellbeing. Thank you, and be well.